right? Or they have like an experience, okay? So this is them. And then what happens is that when they go through a trauma or when they have neglect or they go through a shock trauma, we spoke about it, or developmental trauma, right? Where there's like these ongoing small t traumas or a big trauma, what happens is that they develop like a part of them that helps them function in daily life, right? They could have a part of them that kind of helps them function. Janina Fisher talks about it. According to the structural dissociation model, they call it AMP, apparently normal parts. Janina Fisher doesn't like that term. She calls it the going on with the normal life parts, right? Like you're helping you function. So here are kind of like the adult functional parts, okay? And then what also happens is that there's kind of like the parts that hold the big emotions or trauma or memories or experiences, right? So here, let's just talk about like the self, or we could call it like pre-trauma or pre-traumatized, right? And this could be sometimes like, this could be either like some people have no trauma from when they were younger. Some people do have trauma, ongoing trauma. I don't like simplifying it because like sometimes it's kind of just understanding the concept of self. And then as the self develops, there's a part of them that helps them function, okay? And what happens is it helps them function. So they'll have either like in the functioning part, they might have like a part that like socializes, a part that caretakes, right? If they're a parent, a part that works, right? A part that could be very creative. Like there's a lot of functional parts to it, okay? And then what happens is that there's like emotional or like the emotions or the painful parts, right? Because in functional parts, there are also emotions. They're just emotions that help them function, right? But here there might be like the trauma memories, or you might also have like emotions or repressed emotional experiences right here, okay? And then in here, what you're going to see is that this is like the right part of the brain, or where like the brain and the body hold the traumatic experiences that are too much, and they're almost like on guard to make sure it doesn't happen again. Right? The functional parts, a lot of times, like don't think so much about what happened or don't worry so much about it because it needs to focus on like, what do I need to get done today, right? So it's not thinking so much about it. Now I just want to show you what happens when we go into survival, okay? So what happens is that in this part, in the part that has to go into survival, here we go. In the part that has to go into survival, what you're going to see is that there's many ways that it goes into survival, many ways that we all go into survival. Now I want to show you the different ways that this part, the part that's holding trauma or emotions, expresses itself, or how it takes care of itself, okay? Now we all have this, even if we haven't gone through trauma. All of us have experiences where we're like, there's a whole part of ourselves. We have different experiences, and we have functional parts, social parts, worker parts, nurturing parts, right? We all have parts of ourselves. And then we have parts that have big emotions, feeling left out, feeling sad, feeling betrayed. Some of us have bigger traumas, like if there's sexual abuse, or maybe developmental trauma or neglect or abandonment, whatever it is, right? Or being in a car accident, whatever it is, there's emotions that kind of get kind of stuck in here. Good healing is essentially when we're able to help these parts not feel so frozen in time and not feel stuck in this fear of like, is it going to happen again? Am I in danger? Right? But like we said, we don't do major trauma healing if someone's still in active danger. If someone's still in an environment where they're still being abused or neglected, you're not doing trauma healing. You're going to help them just feel stabilized, normalize that they're having a lot of emotions and symptoms, help them understand it, and then help them function. But let's just go to how the body then processes and how different people's minds and bodies deal when they have big emotions or trauma memories, okay? So I'm going to draw out in different colors the different ways. So there's very common ones that we know about. There's something called fight, right? And there's something called flight. And then there's something called freeze. So a lot of us know like fight or flight. They're like, oh, I went into this fight or flight zone, okay? So there's fight, flight, freeze. The other two that we'll learn about, right? Vanderhart, Neuenhaus, and Steele, Kathy Steele, all talk about like this concept of structural dissociation, and so different ways and different parts that come up. Okay, so I just want to name that too. And Janina Fisher gives all this input and explains it even simpler. Okay, so just to explain the different terms. So what happens is that we know the fight or flight. People say I'm in fight or flight. Freeze, some of us know. Then there's also the submit and attach. And I just want to explain to you how that shows up. And I use this so often with clients because it's so helpful for the clients to understand how, why they're acting the way they are, where it's coming from, and then you can actually work with our systems, okay? So here is fight, okay? And the fight system, if you see here, oh, it's not so bright. Okay, I'll take a picture after and upload it. Here's the fight system. There is the flight system. Hold on. Here's the freeze. Here's the submit. And here's the attach. Okay. What you're going to see here that I wrote, and I write this out. The reason I'm writing this out is I want you to do this with clients. I want you to help them own it for their own selves. Okay. There's a lot of psychoeducational tools that I'm going to link here, and you've seen already. I posted Sandra Paulson and Janina Fisher, and there's a lot of books out there. And I also feel like there's something very relatable when we do work with our clients and we help them see it. So here are some of the ways that our bodies and our minds learn to protect ourselves. Here's fight. Fight is kind of like when you go into fight mode, right? When people present with like a lot of anger, they seem very judgmental or mistrustful. I wonder if you've ever had this. I've had clients or even people I've met where like they meet me and they're almost like trying to read through my body language to try to see like how they could almost like make sure that they don't have to, be in this fight mode, right? Or they are in fight mode without realizing. Sometimes they are controlling and destructive, and sometimes you almost see like a suicidal aspect to them, right? Like I want to fight life. I might want to fight myself, right? When I turn inward. But there's this like fight and this hypervigilance and almost like this need to control, okay? And feeling very judgmental and mistrustful. That's what you're going to see here with a fight, okay? Now, flight is kind of escape. I need to escape. I need to run away, okay? What you're going to see here, and you'll see this in relationships too, not just with trauma, right? People talk about avoidant relationships or avoidant personalities. You're going to see the runner here, right? You're going to see the person who's ambivalent in relationships, the person who can't commit, the person who might be addictive. So an addiction is a form of flight, like running away from feelings, running away from hard conversations, right? They might have disordered eating because they're trying to numb. So there's some kind of disconnection and they're escaping. They're ambivalent. They're always on the run, okay? They're always distancing themselves. Now, freeze is really helpful to also understand. Freeze is when somebody's stuck in fear. What you're going to see here is people who are having like panic attacks. They have lots of emotions, but they're frozen, right? The whole concept of panic attacks, and maybe I'll do a training on panic attacks separately, but panic attacks, essentially, we spoke about this, is like inward, like emotions turned inward, right? Usually anger or like this intensity of rage or any kind of emotion or even sadness or aloneness or whatever it is that's coming up. Freeze is that there's emotions that are frozen and they're stuck inside. So then there's this panic. There's this feeling of freeze and I can't escape. I can't run away. I can't do anything with the energy and it's getting frozen inside. You'll see the people here are usually terrified. They're wary. They're afraid of being seen. Sometimes you'll see people in a situation or in a workplace environment, they're terrified of being seen. They go into freeze or in social environments. And you'll see that they are really just like stuck in this fear. Okay, so freeze. Then what you'll see is submit. Submit, you'll often see that they're stuck in shame. And we're talking about shame in a little bit. But submit is very important to look at, okay? Because what you're going to see here is someone who's filled with depression, very ashamed. They're filled with a lot of self-hate. Sometimes it's like towards themselves, but sometimes there's hate that they're holding about situations and things that happened to them that they kind of became a place that it all landed on them. Sometimes you'll see passivity. You'll see sometimes like the good girl or the good boy who kind of was shamed and is holding all of that inside. The caretaker, the self-sacrificer, right? Submit is kind of like there's the shame. I have to do everything for everyone, right? I gave of everything to everyone and I feel like I have to be the good one right here. So that's kind of like submit and shame. And now the last one is attach, which I think is so important to look at, right? The word attach. Attach is usually a cry for help. What we'll see sometimes when it comes to either adult relationships or even childhood relationships is that the person is looking for connection. They're terrified of abandonment. You'll see I'll work with clients who are in relationships that we all know are toxic or unhealthy or don't fulfill their emotional needs, right? They might be in a relationship with someone who's in flight, who's avoidant and running and ambivalent, but they run for help. Or someone who's abusive, right? or even like running towards a parent who has certain, let's say, tendencies that are unhealthy or unhelpful. But they're so terrified, they're stuck with a part that's so terrified of abandonment that and rejection that they run towards the person, right? Often it's an innocent part and they want someone to depend on, right? It's like, I need you to depend on, I just need a person. Now you want to get curious about what's going on here. A lot of times it's a part that's stuck in trauma, or is a younger part, or is like, or the person has a hard time seeing that they can make good choices and they kind of run towards someone or something. Here you'll sometimes see people like attaching or connecting with the perpetrator, if there was an abuser, or really connecting or like going towards someone who's not good for them, but some part of them feels more safe attaching than disconnecting. And I just want to help you understand all of this, because when we have clients, when they engage in like, right, the fight, which you'll see kind of like is more like angry and control, right? You'll see a lot of anger and control, okay? Or needs to control. The flight, that's ambivalent. The runner, right? Sometimes eating disordered, addictive. The freeze, where you'll see kind of like the fear, frozen, weary, right? Panic attacky, okay? Afraid of being seen. The submit, where you see shame. The good girl, the good boy, right? The caretaker, self-sacrificing, often filled with a lot of anger and self-anger. And the attach is seeking for connection, terrified of abandonment and rejection, right? And want someone to depend on. When we see these things, I just want you to normalize it for your clients and even for your own self, right? But this is normal. These are the ways that our minds and bodies learn to deal in situations. Now, there's actually healthy parts to all of this, by the way, okay? If there is someone who walks into my house without permission, you're going to see a fight part to me who's like, I'm mistrustful, and I am going to want to feel like I want to take control because get out of my house, right? Flight is, I might see that there is some kind of situation where somebody asks me, hey, do you want to sign up for a phone plan? This is amazing, blah, blah, blah. And I have a part of me that's like, and I'll be like, oh yeah, maybe, right? And non-committal because I want to be engaged in like a flighty part of myself, right? It depends on the situation. Not if I'm in a relationship with someone who wants intimacy and I'm like, addicted to my phone or avoiding connection, then that's not the time to be here, right? Then it's to have an honest conversation about what's going on. Freeze. If I'm in a situation, what happens, you'll see sometimes with, I'll see if I can upload the video, right? They talk about like animals when there are animals that they want to trap from the wild. And what happens is that, you'll see how sometimes when an animal who is being run after by a perpetrator, by another animal who wants them, often they'll go to freeze, to kind of feel very frozen. And they sometimes will go to like submit. So essentially, it's kind of like there is something in the freeze response that reduces the feelings of whatever is going on in the body. So there's less feeling of pain. I want to give you the scientific data on that because there's scientific research on basically how some animals, if they prepare to almost like be attacked or be bitten into, there's almost like this numbing sensation that happens that prevents them from feeling the intensity of the pain of being bitten, right? Now, there's a whole other piece that sometimes you'll see sometimes happen. With submit, sometimes you'll see that in certain situations, well, this is not specifically connected to this, but submit is like the shaming, right? Like depressed, ashamed. Sometimes what you will see that people do in certain situations is like, if there's a situation where you're not going to win with a fight or flight, right? If somebody's up against you as a child and they're physically attacking you, sometimes it's not the safest thing to fight against someone who's much bigger. And sometimes the safer thing is to go to freeze or submit, right? I know there was a woman who was in a situation where she was being raped and she was conscious the whole time, but she felt like it was smarter for her to go to submit than to go to fight because the person was such a dangerous person. And by the way, in that situation, she was smarter. All right, that's why when we work with cases like domestic violence, we don't tell them to be assertive in the way that we tell people who are in non-DV cases to be assertive, because there might be actual danger that's involved. So sometimes submitting in a situation is safer for the temporary till they get out of danger, and then they can actually take steps to protect themselves or to heal from the trauma, right? So I just want to name that piece. So here's submit. just explaining in terms of the danger cues and how we protect ourselves, and then here's attach. And there's many different functions to all of these aspects, but just to like normalize it, right? I might attach. Let's say I have a boss who's very, very critical and is very mean to anyone, for everyone, right? There might be a part of me that wants to get my boss's approval because it feels safer, even though it's not healthy for me, and essentially I should probably get out of that workplace, right? But just even noticing when these things come up. When it comes to our clients, you want to get curious which one they might be connected to, or sometimes there's a combination of a few different, survival strategies that they're going towards, and you want to better understand like what's actually going on for them and how can you work with it. Now, sometimes I'll have a client that comes in and like they're engaging with me from a place of attach, right? They're engaging with me from a place of attach. And I might say to them, here, I'm actually here to help you. I want to connect with you and your entire system. And I also want to see if we can connect in a way where there is an adult part of you developing a relationship with me, and also there's emotional parts of you developing a relationship with me. That's the whole concept of dual awareness, right? Dual attention is that you want to be able to have like both the adult of the client and the child part of the client engage with you. We don't want to be pushing for our clients only their inner child or very fragile parts to come out in therapy, even though that's what's going to happen, right? There's all these emotional parts coming up. But in order for therapy to be a safe experience for our clients, what we're going to see is like, we want to be able to help the functional parts. Like when I have clients who like get stuck in an attachment cry or they have certain dynamics, I want to help orient to the fact that they have a functional part and emotional parts coming into therapy, and I can work with both of them. We never want to like promote or like disarm our clients so they feel like they're these little fragile people in our offices and we have their entire nervous systems in our hands. Of course, we're doing that slowly, kind of working with certain symptoms, but we want them to have a sense of capacity to continue functioning in daily life while we're engaging in whatever work that we're doing. So, that's also part of the pacing is like we're doing some work, but we're also really orienting to the fact of where their life is going, what they're doing. I know that the suggestion by the ISSTD, right, the Institute for Dissociation, talks about how a therapy session should be in thirds, right? Like a third is kind of like orienting to the room, getting connected. A third of the session is when you're engaging in good healing work. And the last third is kind of like wrapping up and helping them ground so they could orient to their daily life, right? Some clients need more frequent sessions or maybe a little longer sessions, but I think what's so important is to get good consultation and also to be oriented to really like framing the session so it's in the good format. So just in terms of the survival, right? I would encourage you to do this with your clients or even do it on yourself and be like, I'm wondering how this would show up in your life, right? Or some of us have a few of these, right? I had a client who would go into freeze. As a kid, she was stuck in a freeze. She was in like a functional freeze. And as an adult, she would go into these freeze responses, and we had to work with the part of her that like panicked, the part of her that was stuck in constant terror, and because of certain emotions or experiences she had where she was always stuck in this place of terror. This was our primary work of working with a part of her that had terror and also the part of her that learned to shut down, right? Because it's a protective function. So one part of her had all those emotions. It was too scary to feel it. So another part was like, okay, I'm just going to kind of protect you and help you feel just frightened, right? Fear has a function. If we're afraid, then we don't have to feel, the chronic terror or the danger cue. So we're just going to be so panicky and kind of shut down. And essentially part of good healing work is working with that part, working with the fear, helping it see that it's not anymore in that level of chronic dangerous situation. And now we can help work with the sensations to move through her body in a slow and safe way so that she's not, constantly collapsing into trauma time and to the traumatic experiences of the past, right? So I think that that's a really important piece, and just kind of normalizing how and why they act in that way, and then working with those symptoms, working with those parts is really important.